Everybody's ready?
Yes, sir.
Good morning and thank you for coming. Before I get into the specific facts that I want to discuss, I'd like to recognize some of the officials that we have here. To my right is Parish President Larry Richard, with whom I've been working as president of St. Martin Parish very closely with throughout this situation. To my left, your right, is Dr. Tina Stefanski. I think we all know her, and I appreciate her coming here today. And next to her is one of probably the most respected physicians in the area, Dr. Warren Degatere, who is a physician here in Breaux Bridge. There's several things I want to start out by saying. Number one, I'm not a big fan of these press conferences for a lot of reasons. One of which is I don't want to bring people together as much as you have to when you have a press conference. However, based upon the facts that I'm about to share with you, based upon the statistics I'm about to share with you, I wanted to impart that message one time and one time only, so that we didn't overburden our Department of Health, Dr. Stefanski, my personnel, with having to answer the same question several times to different people. So we believe that it would be a better use of our time to impart one message at one time. Having said that, this morning we have learned that St. Martin Parish now has 11 confirmed cases of COVID-19. The most sobering news about that is that the Louisiana Department of Health has confirmed that 3 of those 11 cases have resulted in death. 2 critical points I think we need to make right now. One is that these test results, some of them, not all of them, but some of these test results are from just the last several days, according to Dr. Stefanski. Therefore, we're dealing with real-time numbers. We're not dealing with tests that may have taken place 8 to 10 days ago in every instance, at least. One of the deaths involves an individual. I can't give a lot of personal information, but this individual was in the 40s, in his 40s, or her 40s, and was otherwise in good health. Another sobering aspect of this is that we have come in St. Martin Parish from no positive tests just a couple days ago now to 11 confirmed cases with 3 deaths. I anticipate that some of the questions that these numbers will prompt will begin with, well, do you anticipate additional measures being imposed? The answer to that is we got measures in place. It's proclamation number 33 JBE 2020, the stay-at-home order issued by the governor of this state last Sunday evening that took effect Monday afternoon. By personal declaration, by St. Martin Parish declaration, by my office, by me, on Monday, I issued a proclamation, actually it was Tuesday afternoon, adopting 33 JBE 2020. More importantly, in our local proclamation, we designated the Office of Emergency Preparedness for St. Martin Parish as the single solitary voice that would apply and interpret 33 JBE 2020. And I want to call everyone's attention to Section 3 of the governor's proclamation. It clearly and unequivocally states that individuals are to remain at home except in very well and clearly defined circumstances. Workers cannot report to work unless they are performing an essential job with an essential business. Section 3 goes further and defines exactly what essential businesses are, referring to the Cybersecurity and Infrastructure Security Agency guidelines. St. Martin Parish has taken those guidelines. We have evaluated them and analyzed them very closely. I'm not certain that every community has done that, if I can be just candid with you. The whole intent of this executive order that the governor issued is really very clear. If you're in doubt, stay at home. That's what the order says. And I'm afraid that many people, many leaders have pandered to certain industries and certain businesses and tried to get around that order. We should be doing just the opposite. So if there's going to be any changes as a result of these test results that we have just received, from St. Martin Parish's perspective, is we're going to more vigorously propagate that message. We're going to more vigorously tell people, please stay at home. I fully understand, fully recognize that a lot of people don't believe this is a real serious medical crisis. Let's face it, there's a lot of people that says, oh, it's no worse than the swine flu, it's no worse than this, it's no worse than that. Well, every health official in this country, every health official in this state doesn't take that approach. So who the hell are we to challenge that? As a matter of fact, that's why I have a well-respected state official here that says these measures are important and must be followed if we're going to get this under control. That's why I have a respected local physician that embraces that same position. And that is why St. Martin Parish embraces that position. So I don't have to depend on what the experts across the country say. We got our own experts that agree with those assessments from the national experts. So, if I can say one thing and implore people to do one thing, is stay at home unless you need to leave to meet those specifically defined categories set forth in Section 3 of the Governor's Executive Order 33 JBE 2020. In some areas, we see activities like golf courses being closed, for example, in St. Martin Parish. In others, they're open. You know, we don't need that lack of uniformity. We need a uniform application. And again, when in doubt as to what it means, and in doubt as to the parameters of the stay-at-home order, you got to interpret it in conjunction with the spirit of that order, which is stay at home unless you meet those specific, well-defined categories set forth in Section 3 of the order. This is serious, and we're going to get through it. We're going to come out okay. As I made a comment at the end, at some point, you know, we're going to look back and say this is going to be our defining moment as a community. But to get there, we need to come together, and we need to quit pandering, if I can be quite frank with you, the special interest people who are trying to find a way to get around the order. And I get that. I get the fact that people don't like to be housed up. I get the fact that businesses don't like to have to close. I get the economic impact. I get all of that. But the health and safety of our community trumps those factors. And I get the fact that people, me included, you know, every chance I get, I like to push an envelope. Well, we as community leaders now need to take that envelope away. And we need to tell our community, be serious, take this seriously, stay at home unless there's an essential reason for you not to. I want to remind everyone of the testing sites that we have, the Cajun Dome site, Iberia Medical opened a site yesterday, I think it was, and they will be testing again Wednesday, yes, as I recall, Larry. You know, but the testing sites aren't sites where you go to get cured. It's not where you go to bring this under control. Where you go to bring it, to get it, to bring this under control, to get a handle on it, is your home, where you ought to stay. But those testing sites remain open. I think I heard this morning in my conversations with LDH during a conference call that there may be a site opening in Opelousas. An observation I want to make about testing sites. I've gotten questions. Why don't we have a testing site in St. Martin Parish? Well, I understand that a testing site is no good unless you got medical personnel that can man the site, unless you've got testing kits to utilize, unless you've got PPE, personal protective equipment, sufficient to protect those people working at those sites. So what we've tried to do as a region is to come together and select certain sites so that we can maximize limited personnel and limited supplies. Indeed, even at the Cajun Dome just last week, they were requesting for volunteers because they couldn't man that site. So those sites and the locations, just not something we pulled out of the air. I think it was something that was talked about and planned for, working with our local medical communities. I thank Iberia Medical Center, I thank Lafayette General and Our Lady of Lourdes. Without them, we would have no sites, quite frankly. The numbers to call, if you experience those symptoms, I'm not going to repeat those. They're all over the place. And when you need to go get screened, all of that is been posted, and you can visit the St. Martin Parish website if necessary. We've got all that set forth in marked detail. So if I can just summarize, this is serious. Everybody needs to take this serious. It is very, very important that we bring the spread of COVID-19 under control. We got to prevent it. These measures give us the tools to do so. So it's up to us now to utilize those tools. As our OEP director observed, the virus is not moving around, people are. Thank you very much. I'll take any questions you may have. Good. Dr. Stefanski, any comments?
Thanks, and just to reiterate what Mr. Cedar so clearly stated, I think the community of Acadiana has the power. We all have the power to control the spread of this virus. It's within everyone who's sitting at home. You've got the power to help us reduce the spread of this infection in this community, and that's simply the only way that we're going to get through this in the position that we want to be in as we get through this. So, sure, Dr. Degater, again, one of the most respected medical professionals in this community and in this state would tell you the same thing, that when you hear communities across this country and even in our own state setting up mobile hospitals or bringing Navy ships in, that is not the level of care that we expect or want to see for anyone in this country. That is not the standard of medical care that we should be practicing. And the only way to prevent us from getting to that point here in Acadiana is to reduce the spread of the virus and to act now. So, some communities around the country, for example, I heard in New York, they're removing basketball goals and closing down parks. So they're doing that now in the midst of a healthcare crisis there, which is important to do. But those are the things that we need to be doing now. We need to not be congregating. Parents need to encourage their children to stay home with them. We know it's hard, it's not easy, it's not hard for adults to do, but it is incredibly important, and I don't know how else to state it because we've been saying this for days now, but if we don't do that in a couple of weeks or maybe a week or two, we're going to be in the midst of a healthcare crisis, and it's going to be a difficult one to solve, and we've got a great medical community who's doing everything that they can, but there are limits. And again, to reiterate what Mr. Cedar said, is we're looking through results as they're coming back for this parish and throughout Acadiana. You're going to see the numbers increase today when those reports are released at noon. We're now seeing quicker turnaround time. So yes, we still have lives that are outstanding from a week ago, but we are seeing results come back, so people that were just tested a couple of days ago. So we know this virus is actively circulating in our community. These are not old cases. So it is important for people now to remain home, not go out unless you're an essential worker, and if you are, go back home. Don't congregate, don't hang out at each other's houses. Again, keep yourself and your children in your house, and that's the only way that we're going to slow the spread of this virus in this community.
To the three individuals, are y'all able to give any general age range? You mentioned one was in their 40s.
Sure. So we're able to give the ages, release the ages of death. So the three individuals in St. Martin Parish, the ages: 41 years old, 70 years old, and 89 years old.
At the time of their deaths, was it known that they were infected with the virus, or was this a posthumous diagnosis?
So we don't give any further information. But these three individuals did die as a result of COVID-19 infection.
Some people are afraid of false negatives when they're being tested for the virus.
Yes. So if someone is not symptomatic at the time they're tested, and they're not actively shedding the virus, they may have a negative result. So oftentimes we have people who are exposed. They have a household member, for example, who's been confirmed to be a case, and they want to be tested. They want to be screened. It doesn't work that way. If you're not actually sick, symptomatic, and shedding the virus, the test will be negative. We don't have the kinds of tests yet to show whether or not you've been exposed.
Dr. Stefanski, without getting into too much detail, did these 3 individuals unfortunately all die on the same day?
So not releasing any of that information at this point. And I do just want to say, our hearts and prayers are with these individuals and their families. Now in hospitals, so people need to be aware too. In hospitals, this has been for several days now. There is a no visitor policy. So individuals who are sick and admitted to a hospital have no one, no family, no visitors with them. So you can imagine the strain on families, on patients, on the healthcare staff caring for them. This is something we've never seen in this country. Can you imagine that we're in this situation? I think people really need to stop and realize that. Churches, we're no longer able to congregate in church. People can't visit loved ones in hospitals. People die alone in a hospital or without their family members. Certainly they're not alone. They have healthcare staff with them. I mean, how else to say, I don't know how else to impart upon people the serious situation that we're in. And as Mr. Cedar said, if anyone thinks this is overblown, they need to step back and look at what's happening around the world, what's happening in our country. It's frightening, and none of these measures are taken without a lot of scientific evidence and a lot of medical evidence to show that this is necessary and indicated. So we all should be concerned. We're seeing cases in younger individuals in this country than has been reported in other countries. We don't know, yet the reason for that. But so young people, just as older individuals, need to be concerned. Mortality is still higher in older individuals, greater than 80, and with underlying health problems. But individuals of all ages can be seriously affected, and we don't know the long-term consequences of this virus. It's new. So for a lot of reasons, everyone of all ages needs to learn that, needs to take heed and understand that as we get more information about this virus, it's more and more concerning for all of us.
And with these being the first 3 deaths here in Acadiana, will these families be able to lay their loved ones to rest, or how is that going to work since they are part of the COVID-19 crisis?
Yeah, so that's probably going to be an answer for the funeral home industry to be able to address. And there will be more deaths reported in Acadiana. There's still notifications to be made. These are the first 3 reported, but these are the first 3 reported. There will be additional deaths, unfortunately, to report.
When people die of the coronavirus, what is the exact cause of death?
So it really depends on a lot of factors, but in general, this virus attacks your lower respiratory system. So pneumonia, respiratory distress, acute respiratory distress syndrome, ORDS. Oftentimes individuals, and Dr. Degater is probably the best qualified to answer this. Lots of these individuals end up on ventilators and really have serious lung injury.
And I know you were saying that for some of these results that they're coming back slightly faster, and so many people are now being tested. Are y'all able to contact everyone to say, no, your test came back negative? I mean, obviously y'all contact the
so
people
it's
that are positive.
right. So it's up to the health. So whoever did the test, whatever healthcare provider did that test, they're going to hear, the patient will hear positive or negative from them. If you're positive, you will also hear from us. The Office of Public Health, our epidemiologist calls and goes through exhaustive phone calls, getting lists of contacts, notifying those individuals, making sure that everyone understands if you're exposed, you need to be quarantined. So it's a very lengthy process. We have epidemiologists, nurses who are working right now making those contacts for the positive. So yes, if you're tested, you should hear positive or negative, and if you have a positive case, you're going to get a more in-depth, of course, conversation with us through public health. And if someone's tested, then they need to stay home. So they should be staying home anyway, right? So it's a message that's just a message, stay home. But if you're tested or if you think you're sick, you need to stay home and further isolate yourself in your house until you get those results, meaning not mingle with everybody else in the household. And a good practice, if you live in the household with someone who has underlying health care problems, then you do need to, we all need to try to keep our distance from those individuals or older individuals to help protect them.
I know yesterday at the Cajun Dome they had mentioned that they're no longer considering diabetes a high risk category to go get tested. Are we looking at sort of revising some of the criteria?
Yeah, so I think as more information, as we're getting more information about those individuals who are most sick and what their underlying healthcare conditions are, I think you're going to see probably some revisions in what high-risk conditions are.
People with coronavirus or believe they may have coronavirus, are there certain medicines that they should be taking or should not be taking?
So right now, so that's the other thing, we have no proven treatment for this infection. So everyone needs to give the healthcare community, the scientists, time to develop these tools to help best guide someone's treatment. So right now there is no proven treatment. So again, another reason we need to slow the spread of the virus in our communities to give time for those answers to be addressed. There's been questions about, is ibuprofen good or bad? And so there's, you may see one study where there's a concern, but it hasn't been proven or validated. So we don't have enough information about this virus, again, which is why people need to stay home, because we don't have the answers to a lot of these questions that are being raised.
With these 3 patients, do y'all believe that they contracted the virus through community spread, or are y'all able to trace it back?
So we can say there's community spread in this. Again, we're talking to individuals, and no one knows where they were affected, where they were infected. They have no. In the great majority of cases, they have no clear contact with anyone who's known to have this virus or who's known to have been sick. Again, a reason that people need to stay home. You don't know. We still don't know enough about asymptomatic spread. So if someone's asymptomatic, doesn't have symptoms, we still don't know enough about their ability to spread to someone else. It's not known, it's not thought to be the main mode of transmission. It's mostly thought when someone's actively coughing or sneezing and in close contact with someone. But there's not enough known.
I know last time when we talked, we were in Lafayette, and I believe it was Claire Taylor from the Advocate had asked about the possible transmission from mosquito bites. Did you possibly get any?
No, we still
info on
haven't
that?
seen. So again, we don't know enough about this virus to be able to answer any of those questions.
Whenever someone starts showing symptoms, how many days do you usually take before that person does pass away?
So it just depends. So I can tell you right now, the best literature is that most people from the time you're exposed, and of course now it's hard to say, who knows when they might have been exposed, but from an exposure, it takes about 5 to 6 days to develop symptoms. And so far, it looks like most people who have, not in our region, but looking at national and international studies, most people around day 7 or 8 into symptoms, that's if they're going to decline, that's usually when they start to. So they might be sick at home for a couple of days, and then it usually gets worse. So for people who are at home, often, like we say for the flu, if your symptoms change, if your symptoms worsen, then you need to call ahead and seek medical attention. If someone's shortness of breath worsens, they get more fatigued and are unable to walk the distances that they normally would have because they're short of breath. That's really one symptom. The fever goes up. They need to call ahead and then seek medical attention.
Thank you, Doctor. Thank y'all for coming. Just one final observation. I'm not a biologist, I'm not a physician, but I will bet you right now that virus cannot read parish lines. So I really think we shouldn't focus so much on how many deaths, how many cases in Lafayette, how many in St. Martin, how many in Iberia. We need to look at this from a global perspective. How many in our area? Too many. Thank you very much.